Hi everyone, my name's Randeep. I am one of the new Menlo Park vloggers, and I'll be keeping you updated on my thoughts and experiences over the coming months of my ST3 placement. I have some thoughts and questions that I'm going to answer, but be sure to follow Menlo Park on LinkedIn, Facebook, Twitter, and YouTube so that you can keep up to date with my videos and the videos of my peers. If you have any questions for me, please do pop them in the comments and I'll try and answer them in my subsequent videos. So today I thought I would try and answer the question why general practice kept me in medicine. And the reason I've chosen this is I think it's a particularly hot topic at the moment. I think most healthcare workers have asked themselves the question during the pandemic or afterwards, should I stay or should I go? And something I read recently, 20,000 doctors have left the profession in the last 12 months. So it's definitely a growing concern. And as I look back on my experiences, I thought about leaving medicine for a number of years, actually, during my medical school training and during the foundation years. And I think what kept me in medicine really was the unique opportunities that general practice had to offer. So I remember seeing my GP as a foundation doctor who told me just apply to general practice, you might surprise yourself. And I haven't really looked back since and haven't jumped ship. So it definitely was good advice. So I thought I'd share just two or three reasons of why general practice kept me in medicine, which I hope are useful. So the first is that it's a 3-year training program as opposed to 7 years for most hospital specialties. And, people refer to medicine as a lifelong commitment rather than simply a job. And I think as doctors, we overlook our kind of mental health and well-being and the impact that the job has on us. And actually, it's a huge plus knowing that you finish training that much earlier, and you're able to take, real ownership over your career that much earlier. So I think that's a big positive for general practice. Another reason I'd say is the portfolio nature. So, you can set up your week as a GP however you want to, and you don't really have to do the same thing every day. So I know GPs that do joint injections and minor surgery to mix up their week. Others who work in prison as the prison GP, GPs who do medical legal work, GPs who do clinical leadership roles in the local PCN. So really, there's no end to really exploiting your interests in a number of different environments, and that really keeps things fresh and keeps things interesting as a GP. And I think the final point for me was the variety that the profession has to offer. So there's a quote, isn't there? Variety is the very spice of life that gives it all flavour. And I think often people view GP as very monotonous and boring jobs. They think that all we see is coughs and colds. And so if I was to give you an example of the patients I saw yesterday, even I saw someone with cow's milk protein allergy, an asthmatic, a new diabetic, someone with hearing loss, admitted someone with renal sepsis, referred someone with suspected prostate cancer. So a wide breadth of patients, and you never see the same thing again and again and again. And I think it's definitely a challenging career, but a challenging career makes for an interesting career. And so that's definitely one of the selling points of general practice as well. So I'd say really to any junior doctors or medical students that were thinking of leaving the profession, don't overlook general practice as an option. It might just keep you in medicine as much as it's kept me. So I hope my thoughts and experiences have been helpful, and I look forward to speaking to you again in the next video. Thank you.